Okay, we are ready to get started. Good morning and welcome to the Thursday, August 4th, Washington State Department of Health media briefing. I'm Nikki Ostergaard, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Tao Sheng Huanget, Chief Science Officer, Michelle Roberts, Assistant Secretary for Prevention and Health, Andrew Rose, Deputy Assistant Secretary of Response Operations, and Naisha K. Williams, Director of Community Relations and Equity. To begin our briefing today, we'll start with opening remarks from Secretary of Health, Dr. Shah. Go ahead, Dr. Shah.
Thanks, Nikki. Appreciate you and our comms team for continuing to help us. It's been a couple months since I've been on our media briefing. We've actually tried to make our media briefings less frequent, and I hope that's good news, welcome news. I know that our media partners have a lot going on as well in terms of covering other things that are happening across our state and our country. Let me start by thanking our media partners, as always, for being here, for spending your time in the summer. We know that it has been hot this past weekend, and obviously we've got some heated temperatures coming up again over the next several days. And we want to just remind everybody that obviously we're nowhere near where we were last year with the heat dome and the kinds of unfortunate play out of people seeking care as we saw last year. But at the same time, we are certainly continuing to remind everybody about the importance of heat safety. So I would just remind everybody, recommend that if you could continue to get messages out, especially for those who are most vulnerable, elderly, those with certain health conditions, especially respiratory disease, asthma, COPD, allergies, et cetera. Those individuals obviously have oftentimes an additional reason to try to stay indoors or stay out of the heat. There are cooling centers that were opened throughout communities across Washington over the last several, few days back. And we know that they will also come open if necessary as we move forward. We have a lot of information on our website about hydration, wearing sunscreen, staying indoors in cooler areas, what to do when you don't have air conditioning, all sorts of information, but we just want to make sure that people are availing themselves of that information. And as you, our media partners, can help us get that info out, we would really appreciate it. There are two major areas that we want to cover during this media briefing. Obviously, during the Q&A, if there are any additional questions, we will certainly take those. The first is around COVID-19, where we are in our state. And then the second is really around Mpv, also known as Monkeypox Virus. We want to make sure to give an update on where things are from a Department of Health standpoint at the state level. So let's start with COVID-19. As you know, we have continued to follow with what we had committed to in our WA Forward plan that was released in March of this year. And that was very much about things that we wanted to make sure our community members were doing to continue to protect themselves and play their part to help our communities, and then things we were going to be doing behind the scenes. We continue along that road, and we will, that WA Forward plan is a reminder. It was scheduled to continue through the end of this year. And so we are absolutely following that plan and continuing to make sure that we are connected on all sorts of activities related to that, whether externally or internally to the field of public health. When we look at cases across the state, obviously we recognize that because of the ubiquity of at-home testing, we know that we have a snapshot of what's happening with cases, but we are seeing that cases seem to be trending either stable or down. And we've also seen that our hospitalizations have also started to come down from the peak that we've had over the last couple of weeks. So it's good news that we have cases that are stable. We certainly have hospitalizations that are stable or on the downward trend. However, we know that there has been a strain in our healthcare system. About 12% of the hospital beds right now are in the state of Washington are occupied by patients with COVID-19. That is a combination of people who are admitted because of a problem or an issue related to COVID-19 directly, or those who were diagnosed once they were in the healthcare system and they were tested as part of protocol or for another reason that was determined by the healthcare provider. But with 12% of hospital beds being occupied with those with COVID-19, it does make it challenging when we have our healthcare system that is strained because of people who have deferred care over time, because we've had people who are getting injured or sick for other reasons, or because they just see a need to have an emergency taken a look at by a healthcare provider in the healthcare system. That means that that same healthcare system that has been taxed with staffing challenges, workforce challenges, is also in the midst of all this still strained by COVID-19 on top of that. So again, we don't see COVID-19 as directly causing the healthcare strain, but we do think that there are impacts of this pandemic that indirectly are really leading to continued concerns in our healthcare system. So our message to our healthcare providers is thank you for everything you have continued to do. Dr. Kwanget and I are healthcare providers, and so we feel very strongly we want to show gratitude for the incredible work that's happened with our doctors and nurses and our assistants and all sorts of the ecosystem of people that are in the healthcare system for everything they continue to do, even though this has been 2+ years of providing care in the midst of a global pandemic. In addition to that, we know that people are tired and we know that they are stressed, and we're doing everything we can to work with our sister agencies, Healthcare Authority, Department of Social and Health Services, and other health entities at the state level, in addition to the governor's office and all sorts of supports at the state level to make sure we're doing everything we can to be supportive of our healthcare system. At the same time, we're also recognizing the challenge that's happening within our public health system. And that public health system is also additionally strained and stressed by 2+ years of the challenges that we've had with COVID-19 and also handling everything else. And I want to give a big thank you to all of our public health partners across the state as well, and really make sure that people recognize that there is a part that both public health and healthcare are playing to protect you in our community. But we're also asking our community members to continue to do the kinds of things they can do to stay protected against COVID-19, but also again against a whole host of other conditions. Number one, first and foremost, when it comes to other conditions, this is the time to be safe, right? We talked about heat just now. You know, people may be getting into the water and swimming. They may be trying to get into a boat or be a vehicle or a trip or some other way that they are going to be in transit. We want to make sure people are being safe and they are trying to protect themselves and those around them. We know that water safety is so critical, heat safety is so critical, but we also recognize that injuries can happen in a whole host of other ways in the summer when people are out and active, whether they're riding a bike or they're jumping on a trampoline or the kids are jumping on a trampoline. We want to make sure that everyone is safe. So help us help you protect our communities is the message that we're trying to share with our community members. So please do your part as well. The other thing, of course, is that we want to make sure that people are also recognizing how they can protect themselves against COVID-19. And again, it's the reminder of the importance of vaccinations and boosters. Again, almost 75% of our population has been at least received 2 doses, fully vaccinated. We recognize that boosters are a critical piece to continue to renew that protection. And Michelle Roberts will be providing some additional information if you have questions about that on COVID-19 vaccines in our state. But the reminder is that it is so critical to be boosted, especially at this time with variants that are still around us. We want to make sure we're doing everything we can to protect our loved ones. And this is particularly true for those in certain age populations, our seniors, our elders. We want to make sure that they get boosted, and also those with comorbidities and or other age considerations. So if you have other significant medical issues, this is the time to get boosted. We want to make sure you protect yourself. Masking in crowded spaces. I know masks have oftentimes not been seen as much across our state or across the country. And recently I took a trip overseas, and I will tell you it's happening across the system, whether it's globally, nationally, or within our state or locally. We're seeing people not wear masks as much. And most, for the most part, that may be okay at times. But what we're also recognizing is that in certain settings, we want people to use their real public health, their health hat. And all of us are public health at heart. All of us want to make sure we protect ourselves and those around us. We care about our communities and our neighbors. We want to do everything we can, which means that if you're in a crowded space, especially in an indoor space, when there isn't good ventilation, when there are people crowded around you, this may be the time to say, hey, maybe you can move a little bit further away, or you can roll up or pull up your mask. And we want to make sure that you do that to protect yourself. And certainly, we know that there are people that are getting sick because of BA.5 and other variants that are more transmissible. We also want to remind everybody of the importance of, if you have symptoms or you have been exposed to somebody with COVID-19, please isolate yourself. Please sequester yourself away from others until you can get tested. Hopefully you have a COVID-19 test at home. We have free tests that are, again, available through our Say Yes to COVID test system. We also know the federal government has free tests that are available. We know you can get those with health insurance, can get them through health insurance. There are other places you can go around the state in various communities to get tested. Please get tested so you know your status and you know if you have COVID-19. And I think that is really important for us to continue to remind to the community. The last thing I would say is summer, yes, we want people to be out and safe, but we also recognize that being out or having windows open or ventilation is really going to help with decreasing risk, decreasing potential for transmission with COVID-19. Again, please be mindful of that and do everything you can to help us help our communities. Let me shift now to monkeypox virus. And this is, as you know, an emerging and evolving situation. We continue to monitor. We've had continued conversations with our state partners, the governor's office, and reminding everybody the importance of what we've been doing here in the state of Washington. In a little bit, you're going to have Dr. Quan Get and Andy Rose, who are on part of Dr. Quan Get and Andy Rose are leading our response for Npv in the state of Washington Department of Health, and they're going to be speaking from their perspectives. Obviously, Dr. Quan Get from a clinical perspective, Andy from an emergency management public health preparedness perspective. And what I also have asked is that Naisha Williams, our Director for Community Relations and Equity, also join us today. And she's going to say a few words because this is a time where we've really seen a real challenge in our community. We have had negative comments, stigmatizing comments, very, very awful, ugly comments that have been lodged against certain peoples in our communities. Had the opportunity with Dr. Quan Get yesterday to meet with some community members as part of the LGBTQ+ community in Seattle proper yesterday. And I will tell you that there were a lot of concerns that were shared with us. And we know this has happened before. It's happened during almost every infectious disease at the start. And the one that obviously everybody is thinking about is HIV and AIDS. And that is such a critical learning lesson 40 years ago for us in this country about what we need to do differently when we are looking at that this is a human disease and it's not limited to any community. We have to do everything we can to remind ourselves that we are all part of our incredible Washington community of nearly 8 million people, and we want to protect each other, we want to help each other, we want to support each other. And that is the reason that we met yesterday, and we're going to continue to have conversations with community members. And in fact, we're going to be asking for our team to create an opportunity for those community members to continue to give us feedback so we know what's happening in communities and can work with our local health jurisdictions, our healthcare partners, and other entities at the local level and community level, community-based organizations, as well as obviously at the state level and our federal partners, so we can continue to combat this real the scourge of misinformation and the scourge of disinformation and bias and harassment that occurs oftentimes when people are concerned or they want to just be ugly about how they treat other people. And I just want to say that from a health perspective and from a physician perspective, I would just hope that we do not do that, because that is unfair, unjust, and it helps none of us. One of the reasons it doesn't help any of us is because when we do stigmatize people, what happens is those individuals tend not to feel comfortable seeking care, feel comfortable sharing that they've got a medical condition, or sharing that they need some help with something. It's the same thing with our 988 launch that occurred just a couple of weeks ago. It's the same concept of misinformation. When 988 is a free 3-digit line, and you call 988 and you have trained mental health counselors, crisis counselors are available. And the misnomer out there was that law enforcement would be picking up those lines. Again, that prevents people from actually wanting to seek care and get the help that they need. And what that does when it's an infectious disease, whether it's tuberculosis or whether it's COVID-19 or whether it's Mpv, is what that does is that people then do not seek that care, and it hurts them, the individual. It hurts the people around that individual because they're now potentially at risk, and it hurts the entire community because then we do not know as a public health system who has a certain condition or a disease, so we can help monitor, help support, and ultimately in the case of Mpv, to vaccinate. So I think that is a key message that we want to please have you help us. And I'm just so incredibly gratified that we had community members that were willing to come and speak to us and spend time with us yesterday. Some of that is on social media. I'm supposed to retweet a few more. It's been a little busy. I haven't been able to do as much as I usually do, but I would recognize that that is so critical to the work that we are doing. So if we can continue to work together, I would really, really ask us to do that and appreciate that. Let me now ask our team to pull up. I know that they had pulled up the milestone dates. If we could pull that slide back up. I want to tell you what we are doing at the Department of Health in terms of Mpv. And as that slide gets up, I'm going to get a quick swig of coffee here. All right. So as you can see, in late May, we had this joint announcement that we had the first probable case in the state of Washington, which a few days later was confirmed as the first case in the state of Washington. And we join now, unfortunately, the majority of states across the country and many countries across the globe to have cases in their jurisdiction. A couple of days after this announcement of the probable case, we leaned forward and established a monkeypox, which has now been changed to Mpv. We're still waiting for an official change designation on the word. We know that the word monkeypox is also stigmatizing, so we are also interchangeably using both words right now, but I just want you to know, please be on the lookout that this will likely be changing at some point soon. A couple of days later, May 25th, we established a Mpv Readiness Group, and it was really to lean forward and do all the different things that we need to do as a state agency, and also work with our other state partners and local community partners as well. And then as we continued to see the evolution and the continued number of cases that we were having in the state of Washington, we activated about 2 weeks ago an incident management team as part of our ICS, our incident command structure. That is where Dr. Quan Gat and Andy Rose fit in. They are leading that response, and Andy is our incident commander. Dr. Quan Gat is our agency administrator, and we went ahead and established that because we felt very strongly we wanted to stay ahead of the curve. The next day, the WHO declared monkeypox a global health, a public health emergency. If you remember, we are still watching what's happening across other states, and certainly we welcome the announcement by the federal government 2 days ago to establish 2 coordinators, one from FEMA, one from CDC, to lead the Biden administration response on Mpv, and we're continuing to watch what's happening related to that. If I could have the next slide up around numbers and the map. So where are we today? Where we are today is that the threat of monkeypox to the general population, again, as of today, unless some changes happen with this virus, we do not anticipate, remains low. However, we are seeing a worrisome increase in cases across the globe, across the country, and certainly in the state of Washington. We have 166 cases. Dr. Quanget is going to go through some more details about this. 166 cases to date in the state of Washington, and a vast majority of those are in King County. And as you see now, we have multiple counties that have had at least one case reported in the state of Washington. And so this is why this is now a multi-jurisdictional, multi-community response, and why the State Department of Health continues to remain the coordinator and leading the efforts across the state. But obviously we cannot do it without our local partners on the ground who are doing such an amazing job. And remember, in the context of coming off of or continuing in COVID-19 response. And I just want to say, I just can't say enough about local public health and the work that they do, because we know that efforts are oftentimes behind the scenes, and we want to make sure that we recognize that. The map also indicated that there are many communities that do not have reported cases that are confirmed of Mpv currently in our state of Washington. We anticipate that that will start to change, and you'll start to see more and more cases, especially in some of our larger jurisdictions. This is not a concern per se, because the map all of a sudden starts to see more and more counties. It is a natural consequence of infectious disease transmission that you start to see additional transmission happening across jurisdictional lines. And that is why we want to continue to do everything that we can to support our local communities. While this disease is disproportionately impacting the LGBTQ+ community, again, Dr. Quanget can provide some additional details. We know this is a human disease. It's about the behaviors and not one specific to sexual orientation or gender identity. Anyone can get Mpv through close contact with someone with an infectious rash related to Mpv, or also with, we believe, some transmission potential through touching of linens or clothing that has been exposed to Mpv virus as well. So I just want to make sure that we say that because this has been the stigma that's been out there of a certain community that's been stigmatized. From a vaccine standpoint, again, supplies remain limited. We are expecting more doses from the federal government. That's why it makes it very difficult and challenging for us to continue to work with our communities when we don't have as much of the vaccine supply. But we recognize that we have maybe 4 or 5 different roles right now that we're playing. One is in outreach and engagement, messaging, and making sure we get the word out. Our audiences are fourfold. There are those who are most at risk, as we talked about in terms of behaviors. We also know there's a message to the general public that is also in the mix. We have healthcare providers. We want to make sure they have information so they know what to do when somebody presents with a rash, or how to go about diagnosing, or what are the testing modalities. And then the last is our partners and the incredible partners on the ground that are doing so much work, and our state partners as well. We also know that the second area in addition to outreach and messaging is around diagnostics and testing. And that is something that Dr. Quanget and Andy will speak about. Diagnostics and testing is so critical to making sure that we know what's happening and where it's happening and to whom it's happening within the state of Washington. The third area is contact tracing. This is a term that you've heard before, I'm sure, from our COVID-19 days. And this is really, again, somebody who has been positive for Mpv to know who has been in close contact with that individual, so we can offer then the fourth modality, which is either therapeutics like antivirals or vaccines. And again, this is the limited supply that we have currently, but also making sure that we are on top of that. And then the final piece is liaison activities, which is just handling the myriad of questions that are coming in, whether from partners, from policymakers, from elected officials, or from our community members, or from the media. And we want to thank all of you for continuing to ask us questions. We're on it. We're doing everything we can to respond. Sometimes it takes a little bit of time for us to respond as quickly as I know you would like, but we're doing everything we can to be able to respond as quickly as we can. And we want to be collaborative because ultimately you can help us get that word out to people, and also making sure that we're doing everything we can to continue to work risk in our community. We are very concerned about those communities who are more vulnerable. We're very concerned about this potentially moving into other populations that might be more frail, for example, with other infectious diseases or immunity types of challenges. They're on chronic steroids, or they have HIV, or they're with cancer treatment, or we're also concerned about communities of color who oftentimes have access issues, whether it's in our tribal communities, whether it's in our African American or Hispanic communities. We also are obviously concerned about our elderly and our children. So there's a lot that's happening right now. We're taking a very equitable access approach, all in, to make sure we're doing everything we can to continue to protect people and those around those people. But again, if we stigmatize those very people for coming forth, it is not going to help any of us be successful as we move forward. The last thing I want to say, and then I'm going to turn it over to Dr. Kwan Get, is that just a couple of days ago, our department released its strategic priorities. This is our transformation plan, a roadmap for a vision of health for the state of Washington. Transformational plan, a vision of health for the state of Washington. And just ask you all to take a look at that. It is on our website. We're going to be doing some more information and media about this and getting word out about this. There are 5 strategic priority areas. Very quickly: health and wellness, environmental health. There is emergency response and resilience. There's capacity building around workforce and infrastructure. And then the 5th one is global and one health, global health, and then humans, animals, and the environment. And I would ask you to look at this. This is an incredibly leaning forward plan that is going to really point the way for our Department of Health and our partners across the system in public health over the next few years. And we would just really hope that you have a chance to take a look at that. So I hope this is helpful. I know I put a lot of information in here, and I hope half of it made sense. And the other half, I hope that didn't, that Dr. Kwan Get, Michelle, Naisha, and Andy will be able to bring some more light to it. And all joking aside, this is a very difficult time for everyone. We want to make sure we're doing everything we can to continue to fight all sorts of conditions in our communities. And with that, Dr. Kwan Get, I will turn it over to you.
Thanks, Dr. Shah, and good morning, everybody. I'd like to take a few moments to talk more about the epidemiology, transmission, and prevention of Npv. And as we all know, Washington is continuing to see a growing number of Npv infections. And as Dr. Shah mentioned, our response is focused on supporting tribal partners and local health jurisdictions in helping those infected with Npv get tested and, if necessary, treated. And it's also a very high priority for us to prevent Npv by vaccinating those at highest risk of infection. So Npv is a virus that's not normally found in the United States, and the illness may begin with flu-like symptoms. A few days later, the person may develop an unusual rash, which is sometimes painful. The rash starts off as little red bumps that can then become fluid-filled and eventually turn into scabs that then fall off. So anyone who has close physical contact with a person with an infectious rash can get Npv. And this includes direct contact with the skin or bodily fluids of an infected person, or touching bedding or clothing used by someone with Npv. During the initial flu-like illness, Npv can also be spread through respiratory droplets through prolonged face-to-face contact, but it's really most commonly spread through direct skin-to-skin contact. Dr. Shah mentioned our most recent case counts, and cases in Washington have been doubling roughly every 7 to 8 days. Cases have been in adults with no pediatric cases in Washington, and currently is disproportionately affecting the LGBTQ+ community, particularly gay and bisexual men. But it's important to know that anyone can get Npv regardless of sexual orientation or gender identity. As I mentioned earlier, Npv can be spread through any kind of direct contact with the rash, sores, or scabs of an infected person. And this can occur when hugging, massaging, kissing, having sexual or intimate contact, or even attending a crowded event where there's skin-to-skin contact with other people. Npv can also be spread by touching objects, clothing, bedding, towels, and surfaces that have been used by someone with an infectious rash. But it's important to know that brief interactions that don't involve any physical contact and healthcare interactions using appropriate protective equipment are not considered close contacts or high risk of infection. So regarding testing and treatment, early in the outbreak, testing for Npv was done at the Washington Public Health Laboratories. And as the outbreak has grown and demand for testing has increased, our state has added 9 private labs capable of Npv testing. So if you've been exposed and have symptoms, or if you have a rash you are concerned might be Npv, contact a healthcare provider immediately to have it checked out and to possibly get tested and, if necessary, treated. If you do not have a healthcare provider or health insurance, please reach out to your local health department for guidance. Fortunately, most people with Npv infection recover in 2 to 4 weeks without any treatment, but the disease can be serious, especially for immunocompromised people, children, and pregnant women. People with severe disease or at high risk of severe disease can be treated with an antiviral medication called TPOXX. Fortunately, there have been no reported deaths in the United States during the current outbreak. So in conclusion, watch for any new rash or skin lesions and contact your healthcare provider if you think you might be infected with Npv. Keep rashes covered and avoid skin-to-skin contact with anyone with a rash or skin lesions. And remember that anyone from any community can be infected with Npv. There's absolutely no place for stigma in our community's response to monkeypox. We can all take steps to protect ourselves and our community from Npv, and we are not safe from Npv until all of us in every community is safe from Npv. So thanks. Back to you, Nikki or Michelle.
Thank you so much, Dr. Kwanget. I wanted to give the opportunity for Director of Community Relations and Equity, Nyesha Williams, to give some comments in relation to equity.
Thank you. Good morning, everyone. With COVID, the best practices for equitable vaccine distribution emerged, and as lessons learned, we are employing a community-informed best practices for Npv. Again, we want to emphasize that anyone can get Npv and promote it as a public health concern for all. Our emerging stigma reduction strategy has multiple components. First, we are engaging trusted community-based organizations, community leaders, and community healthcare providers to connect with communities and to learn more about the challenges and concerns, as well as provide community partners with toolkits and resources. We want to promote messaging that provides information on what Npv is and how it can be spread, and encourage everyone, if they have concerns, to seek medical treatment. And as previously mentioned, Npv is spread through direct contact with infectious rash, scabs or bodily fluids, also respiratory secretions during prolonged face-to-face contact or during intimate physical contact such as kissing, cuddling, and sex, and also touching objects, fabrics such as clothing or linens that were previously touched by the rash or bodily fluids of someone with Npv. Again, we want to emphasize that Npv can be acquired by all people, regardless of gender identity or sexual orientation. And lastly, our IMT, our incident management team, also includes an equity officer in the incident command structure. The equity officer will be integral in community outreach and ensuring that equity is in the forefront of our response. Back to you, Michelle.
Thank you, Nyesha. We'll now go to Assistant Secretary Michelle Roberts.
Sorry, Nikki.
Go ahead, Dr. Shaw.
Yeah, Nikki, I just wanted to, if it's okay, just before Michelle speaks, just to thank Naisha for bringing up these comments. And this is really the reason we wanted Naisha to be here, because we do believe this is not just about the disease, but it's about how we approach the people that are really in concern about this in communities across our state. And so I hope that our media partners will continue to reach out, especially with concerns or questions that Naisha and our team on the equity side can answer. This is such a critical piece for us at this point, and we just want to make sure that we're doing everything we can to continue to remind people that this is a disease that really is very much about the behaviors and not necessarily about stigmatizing, and not about stigmatizing a certain segment of our population. So thank you, Naisha, for saying that. And Michelle, we'll turn it to you.
Great. Well, thank you, Michelle Roberts, and it's good to be here today. As a reminder, I direct our agency's immunization teams. So today I want to give you an update around what's happening with MPV vaccination. So the Washington State Department of Health is working aggressively to obtain and provide as much of our limited vaccine allocation as possible to help control the MPV outbreak. The Gianos vaccine remains in limited supply, and we're expecting more doses soon. This vaccine is FDA licensed to be given in 2 doses, 28 days apart. We have already ordered and distributed over 6,800 doses of vaccine. This is over 95% of our first 2 rounds of our federal allocation. We've also been allocated more than 17,000 additional doses of vaccine. That vaccine is going to be broken into 3 waves over the next 4 to 6 weeks. And our order for the first wave of that third, for the first allotment of that additional 17,000 doses is in process, the order is. We're working to finalize the systems and reports to be able to share out data on how many doses have been administered and given, as reported to the state's immunization information system. Right now, we are adopting a first dose prioritization strategy to ensure we can deliver vaccines to as many people in high-risk populations as possible. So that means we're focused on getting our first doses out as quickly as possible, and then we would provide second doses, recommended 28 days or later as more vaccine becomes available. Vaccine right now has initially been prioritized for people who've been exposed or who are at high risk of exposure for being exposed to MPV. Washington is ordering vaccines from the federal government as more doses become eligible. I mentioned that we've ordered and distributed 96% of our doses allocated so far, and shared a little bit about how many doses we've been given, including more than 7,000 doses in our initial allocation, and then this third wave at 17,000 doses. With the first wave, we're starting to order as we speak. Less than 5% of the vaccine supply has been held back for DOH to be redistributed to counties and tribes in urgent needs of supply as new counties become identified with new cases. We are working very closely with local health jurisdictions to place orders and plan redistribution this week, and anticipate that additional doses, the first wave of this 17,000 doses, could arrive in Washington as early as the end of this week and more next week. That's the first 40% of that 17,000 doses. We'll be able to order another 30% of that vaccine on August 15th. We don't have an exact date from the federal government about when we're going to be ordering the remaining 30%, but we expect that to be later in August or early September. Again, we're working to make sure we get as many first doses out as possible to the communities most at risk. If you think you've been exposed to MPV or you are at high risk, please contact your healthcare provider or your local health jurisdiction for more information on how to receive a vaccine. In conclusion, to make sure that vaccines get to as many people at risk of infection as possible, we're working with tribal partners, local health jurisdictions, and community partners to reach vulnerable communities and ensure equitable access. While we work to build up vaccine supplies, it's important to protect yourself and those around you. So if you notice a rash, please keep it covered, seek medical attention, and avoid close contact with others until the rash is gone. Thank you.
Thank you, Assistant Secretary Michelle Roberts. This brings us to the Q&A segment of today's briefing. We do have several media in the queue today, and we will try to get to everybody with the time allotted and stay within our time to respect your time as well. First on our list, we have Paige Browning with KUOW. Paige, you should have permission to talk.
Hi there. Thank you for making time with this and for the update today. I wanted to first ask, has the state declared it a public health emergency in Washington state or any parts of the state?
Thanks, Paige, for that. Sorry, I lost my unmute button, so I couldn't find it. Your question was about public health emergency declaration in the state of Washington or any part of the state of Washington. Is that correct?
Yes, correct.
Yeah, we have not. And let me explain that. We have continued to follow very closely, obviously, with the governor's office and with other partners at the state, including emergency management. Andy Rose, again, as our incident commander, continues to monitor what's occurring across our system and our need for any further declarations. Right now, we're at a point where we continue to be able to have the flow of information and the flow of resources that we need in order to be able to respond effectively for our state. So we have not declared a public health emergency, and certainly we continue to watch that, monitor that. We know what's happening in other states, also watching what's happening at the federal level, but we do not at this point plan on making such declaration anytime imminently soon. But again, things can always change. We're certainly monitoring very closely with our governor's office.
Thank you. Our next question comes from Nicole Jennings with Cairo Radio. Nicole, go ahead. Nicole, if you're there, we just need you to unmute your mic.
Hello, can you hear me?
Yes, go ahead.
I'm so sorry, I got put on another story while I was on this multitasking here. I'm wondering about on COVID, the timeline for second boosters for young adults. We've been told for a while that the federal government is considering expanding this group. For so many of us, myself included, we're now 8 months past that first booster. And with these new, more contagious variants spreading, it's quite worrisome. So I'm wondering, do we have any indication of when this eligible group will expand? And if we have to wait until the new vaccines come out in the fall, will those first be prioritized for older adults and the younger crowd who, tend to be the ones going out to restaurants and working in person? Are they going to have to wait even longer?
Yeah, thanks, Nicole. I'm going to turn that over to Michelle. One overarching comment that I want to make is you said something very important, which was waiting for something in the fall. And I think the reminder is those who are eligible for boosters right now, if you're in the age or the category from a comorbidity and disease standpoint, and you are eligible for boosters now, we are recommending that you go ahead and get that booster now and not wait. So I just want to make sure to add that to the context here. And then Michelle, maybe some additional comments from you as well.
Yeah, great question. So I'll echo starting where Dr. Shah did. It's really critical that everybody who's eligible for a booster dose of vaccine goes ahead and goes out and gets that dose now. That will help continue the best protection for you individually, but can also help limit the amount of disease that's spreading in our communities as well. Right now, we do have significant gaps in who is getting booster doses of vaccine. Just about 57% of people who are eligible for additional doses have gotten those additional doses. And we do see gaps by age and race ethnicity. That data is on our website, and we just really encourage to everybody to continue to talk about how important it is to stay up to date. We're all anxiously awaiting final news about what's coming this fall with a Omicron specific booster. We do expect that's probably a matter of, we don't have exact timing from the federal government, but weeks, not months away potentially. We know this week the federal government seems to have finalized their purchase of those vaccines from Moderna and Pfizer, and they're working to make sure states know information on what the timing of a rollout will be and how many doses. Really, decisions on prioritization and other pieces will be made depending on how many doses will be available to each state, but also will initially be recommended from the Advisory Committee on Immunization Practices at the CDC. So we still need, even though there's some vaccine purchase, there's a few additional steps, including FDA and CDC meetings that need to happen, and then a little bit of additional information we're waiting for. You still have the vaccines, while they do wane with a protection against infection, protection against severe side effects is holding strong with these vaccines, even if you've just had a primary series or you've had your one booster. So that is fantastic news. I mean, really, if we get into a need to prioritize or looking at rollout over time, although some populations may have been farther out, especially if you're under 50 from your last dose of COVID vaccine. But really, one of the most important things we can do is continue to protect those at highest risk, including our older adults, from severe side effects, from hospitalization, which really helps protect us all by keeping older adults out of the hospital, since they're more likely to have severe side effects, which helps preserve our hospital capacity for all of us.
Thank you. Our next question comes from Elise Takahama with Seattle Times. Elise, you should be able to talk. Go ahead.
Hi there. Thank you all so much for doing this today. I just wanted to get a little bit of clarification. Michelle, I know you were talking about the state requesting different allocations of vaccine at different times, but has the state requested its full allocation of vaccine from the federal government, and how much exactly would that be? And then just to clarify the eligibility requirements for the vaccine, is the state now allowing people who are at high risk of exposure to get the shots in addition to those who have confirmed exposures?
Yeah, great question. I wonder if we could put the slide back up with the vaccine, our vaccine allocation numbers. But I do want to share that at a high level, we've ordered over 96% of the vaccine that's been allocated to us. So we are ordering the vaccine that we have in supply. Some of that remaining allocation is just knowing we've got additional counties that are having cases and making sure we have a little bit of flexibility. And then also our commitment to our tribal nation partners to make sure they have vaccine ready when they have cases. So phase one, you can see that 796 doses, those have been ordered. Phase two, A, 2,700 doses. Phase 2B, 3,600 doses, and this first phase of the phase 3, which will be 17,200 doses total, but the first allocation of that is 40%, 6,900 doses, and yes, that is being ordered right now this week, and the vaccine that we expect to start arriving in the state later this week. Or early next week. We can start ordering the rest of phase 3 or the next 30% of phase 3 around August 16th. And then we're waiting for a final date of when the remaining 30% will be available to the state from the federal government. But we expect that will be late August or early September.
Thank you.
Michelle, did you want to, about criteria?
Oh, thank you. Second half of the question.
Okay.
Yes, right now we are working on moving to try to get as many vaccine out as possible. So definitely available for anyone who's had direct exposure to somebody who has had who has NPV, but also moving to expand that beyond just the group who's had direct exposure to people who are high risk of exposure. So that would be maybe that if you have been in a setting where we know there is a case, someone who's had monkeypox has had vaccine. We do not have enough vaccine to open up broadly to the whole LGBTQ community or to those at highest risk at this point. As more vaccine becomes available, we'll be opening up more broadly to anybody who's at high risk of exposure, but there's just not enough vaccine at this point yet.
Yeah, and if I could just add, Michelle, some additional context, which is that we have made it very clear to our department's incident command structure, as well as all of our partners, that we're going to do everything we can to get vaccines in, Mpv vaccines in the state of Washington. Obviously, there is an allotment. There's an allocation that we can't go above because it really is set by the federal government. But we're doing everything we can to get to make sure that we get the vaccine in our state as quickly as possible, so we don't have it sitting somewhere, but it's actually in the arms of people. And that is the most important thing. There was a report several days back which said that there was a lesser amount that we had ordered, and I believe that there was a snafu of the timestamp of when they pulled the data versus when our ordering went in. And so Michelle is giving you the most up-to-date information that we have ordered at least 96% of our allotment, and that is going to continue to occur. Now, we do not have enough vaccine across the country to meet the demands of everybody who may think that they want or need the vaccine. And so we have to make priority decisions in addition in consultation with our healthcare providers and our local health departments in terms of who are the persons who are most likely to benefit from and appropriate for the vaccine. And that's what we're working through right now. It is going to evolve, and we want to make sure people recognize the evolutionary nature of this response. Is that initially we don't have enough. We do believe we're going to get more. It may still not be enough. That said, we're going to do everything we can to prioritize those who are most at risk. And the final comment about this is really about the education and the prevention messaging, because vaccine is absolutely critical, but what is even more critical is prevention, 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 to take the steps that we know people can take to protect themselves. And that is what Dr. Kwanget just highlighted, and that is so critical to our path forward, is to be prevention oriented as we consider our actions and behaviors that put us at potential risk for Mpv, COVID-19, or any other disease that's out there. Nikki.
Thank you. Our next question comes from Matt Baum with The Stranger. Matt, you should be able to unmute. Go ahead.
Thank you so much. I just wanted to follow up on that last question and wanted to clarify, because there was that Kaiser Family Foundation report that indicated that as of July 22nd, Washington had only ordered 50% of the doses that were allocated to the state. And I know, Dr. Shaw, you touched on this, and just wanted to be clear, is that report from Kaiser inaccurate? And also, has there been any point at which the state could have ordered more doses than it did, but for some reason did not?
Yeah, thanks, Matt. So inaccurate, we can debate back and forth. I think what I would say is that when they pull their data, the data pull was in advance of when our ordering was available to us. When we were able to order that, which was a couple of days later, we were able to order more. And that's when the 96%, or not at that moment, but from that forward, we were now gone to that 96% number. Andy might be able to answer a little bit better, but I will say it's a complicated, complex ordering system, and it does require quite a bit of choreographed dance with our federal partners, and that requires at times that you'll have some data lags that will occur, and if you pull the data at a certain time, it may show something higher or lower, but we are trying to do everything we can to be consistently at or at near full capacity of the ordering allotment that is available to us. So I hope that clarifies that. But Andy, do you want to add anything on the ordering side?
Yeah, thanks, Dr. Shaw. Just real quick, I'll say, when we do get our allotments, our process for the equitable distribution of that vaccine across the state is at 100%. That includes a little bit of holdback, as Michelle mentioned, for us to be able to rapidly distribute to a county with a new case. What happened in that instance with the KFF article was exactly what Dr. Shaw said. In the time we got our allocation till we went through our strategy to identify the numbers and where it's being shipped, it was a 2-day time frame for the feds to process our order. So on the 24th, we saw the actual numbers hit their system. So it was a 48-hour delay in just the way it gets processed. There has been several hiccups with the federal system over the last few weeks in ordering. So that has caused some delays for many states across the country to get timely orders in to our federal partners. So it's expected with technology, but we are at every instance of allocation ordering everything that's available to the state of Washington.
And we have one last thing is we did follow up with the Kaiser Family Foundation as well to clarify our ordering allotment percentage.
Yeah, and the other piece I just want to share is that our process for equitable distribution, like Andy was saying, also includes working with county health departments about the right places to send that vaccine. Unlike COVID vaccine and routine childhood vaccines, at this point from the federal government, we're limited on the number of sites we can send vaccine to. Hopefully that's going to change with the federal government as their systems increase and improve over time. So we do work with communities on the ground and local health departments who are working with providers in the community to decide the best places to send the vaccine. And that coordination takes a little bit of time as we're ready to make sure we're sending vaccine to the best places possible as directed by local community.
We have 3 more reporters in the queue, so we'll try and get this done within the next couple of minutes. Jennifer Lee, you are up with Fox 13. You should be able to unmute.
Yep, thank you so much. Appreciate everyone taking the time to take these questions. I've seen reports in the last week or so of some people traveling north to Canada to access a vaccine for Mpv. Is going to such lengths to get one recommended? Why or why not? And then touching back on declaring Mpv a public health emergency here in Washington state, what kind of scenario would prompt DOH and state leaders to make such a declaration? And finally, at this point, what would be a best case scenario, and is the possibility of getting Mpv under control still realistic?
Okay, Jennifer, so you asked 3 questions in one, so we'll do our best to try to go through those. I would always say that in terms of trying to seek vaccine elsewhere or care elsewhere, that options are always there for people. What I recommend to my patients is to always try to get it in your local area, the care that's needed, whether it's a vaccine or it's some other therapeutic, because if you have a side effect or if you have a concern, if you have a question, it's always harder than to go back to the healthcare provider where you were getting that care. So it's just to me, it's a simple answer of try to stay as local as possible. And certainly the reasons that people drive to different lengths to be able to get care, I think gets back to some of the concerns that people have when they get concerned or anxious that there is just not enough to go around, and then they feel like they need to go through some additional steps. So that is absolutely something that we're aware of, but I will say that I would encourage people to continue to remain patient and work through the system that we have established here, because I do think we are going to get, and as Michelle has shown, we know that we're going to be getting additional doses here in the state of Washington. The second question was around the public health declaration, emergency declaration. I would say, as I answered earlier, it's really about if we feel that one, there is some significant evolution in the transmission or increase in the number of cases that we have in the state of Washington. Dr. Quanget nicely reminded everybody that it's about a week to 8-9 days as you get doubling. So we anticipate in the next week or 10 days, we may be in the 300-400 range of cases. Again, the reminder as we start to get that, we would, if we started to get an incredible increase, or we're concerned that we can't handle what's happening. And remember, we also have some COVID declarations or proclamations that are also in place. So it does allow us a little bit of wiggle room that we have not had if we had not had those either emergencies in place. And then the key issue is about resources. Ultimately, it's about resources to make sure that resources are available. And then your last question is now I'm blanking on. Does anybody on our team remember her last question?
Yeah, I think the question was, what's the best case scenario? And yeah.
Do you want to? Why don't you answer that one?
Yeah, sure. I'd be happy to. Well, I think one piece of information we have is past outbreaks of Mpv that have occurred. And these have been in parts of Western Africa where the virus is endemic and also and zootic among the animals there. And those outbreaks have been limited. So this outbreak is very unusual for Mpv outbreaks in its size and scope. But absolutely, what we do makes a difference. When we look at COVID-19, our state has one of the lowest death rates in the country compared to other states because Washingtonians have stepped up, gotten vaccinated, practiced masking and social distancing. And so what we've done as a community has made a difference. Similarly, I think with monkeypox, with Mpv, what we do can make a difference. And it's not just vaccine. We've talked about how if you have a rash that you're worried is new and might be monkeypox, then it's really important for prevention that you avoid direct skin-to-skin contact with other people until you have a chance to have it checked out by your healthcare provider. Similarly, if you're doing something that involves physical contact with other people, and you notice others have a new rash and they don't know what it is, then it's important to say, hey, why don't you get that checked out, and why don't we let's put a hold on this activity until you get that checked out, so we can make sure that it's not Mpv. And it's also important to remember that Mpv is just one of many, many viruses and bacteria that can be spread by an infectious rash. So a lot of the prevention messages that we have today are ones that we would give for Mpv before this Mpv outbreak, which is, if you have a new possibly infectious rash, keep it covered, avoid physical contact with others until you have a chance to see a healthcare provider to get it checked out and tested and treated. So I think we absolutely do have an opportunity to control the outbreak. Thanks.
Yeah, and Dr. Guanget, I think you hit on something that I should have emphasized earlier, which is just remembering that the prevention strategy is not only about vaccines. And so I know her question is about people going elsewhere to get vaccines, but we have to remember that it's not only about vaccines. In fact, vaccines in this case really continue to, are very important, and obviously around severity of disease and decreasing the risk of complications or having hospitalization, et cetera. But we also want to emphasize exactly what you just did, which is prevention, prevention, prevention. I said it a couple of times, but I'll say it again, that we have other ways that continue to remind us of how we can protect ourselves, our loved ones, and those around us. And we should continue to remember those strategies. And again, if you can help us get that information out there, vaccine is one of those tools. It is not the only tool. And so please help us spread that word to others in our communities.
Thank you. Our next question comes from Santiago Ochoa with the Yakima Herald. Santiago, go ahead.
Hello. Yes, thank you guys for making the time to do this today. Dr. Shaw, you mentioned that COVID cases across the state are trending stable or down. What would you attribute this to?
Thanks, Santiago. I would attribute it to a number of factors. One is that it's summer, and we have people that are outdoors, and I think that always has helped in terms of any viral respiratory virus, that it helps to just be outdoors, or windows open, ventilation, et cetera, that helps the flow of air. That's one of the factors. The other is that we have so many people who have either a combination of vaccination plus booster, or have been infected. And I think there has been some immunity spread across our state, a significant amount of immunity spread across our state that's also helped us. And then third, I just, the caveat that I always want to say with cases is that we just have to remember that because of the advent of at-home testing and other modalities, or even people saying, look, I'm not going to even get tested, I assume that I have something, which we again want to recommend people get tested, whether at home or through a healthcare provider or local health department. We want to just make sure that people do get tested, but because of that, you also have a potential decrease in numbers. So again, we are focused on hospitalizations. We continue to monitor, and that's the measure, that's the indicator that's really critical for us. That does not mean that we do not look at all the other numbers that are out there, but it is really important for us to keep all the caveats in mind. The last thing I would say is that Santiago, there is obviously folks in certain areas we hope are listening to our recommendation, which is to wear a mask when you're indoors or in a crowded setting, or to be socially distant. So we do hope that as many people would be listening to that, but at least hopeful that certain people are, as many people can be, benefited by making sure that they're taking those preventive strategies. Again, a common theme in two different viruses, a theme of prevention and protection for Mpv, a theme of prevention and protection for COVID-19.
Thank you. Our final question comes from Melissa Santos with Axios. Go ahead, Melissa.
Hi there, Dr. Shaw and others. I'm just wondering if there's an estimate statewide for how many people are at highest risk or elevated risk for monkeypox exposure, because King County, I think last week was saying it's something like 40,000 people, I think just in King County. So do you know how many statewide kind of fall in those categories of elevated or high risk for monkeypox exposure?
Yeah, it's Melissa, a great question, and maybe Dr. Kwanget has some information. I know we've asked our modelers to look at this across the state to help answer that exact question. I don't know if he has any updates on that. What I would say is that, you know, there has been some confusion about, you know, is this a sexually transmitted infection? And what Dr. Kwanget so nicely said yesterday during the community meeting is that it is not a sexually transmitted infection, but maybe behaving that way. It may be mimicking that because of the behaviors that are leading to the potential spread right now. But again, we're mindful that that may change over time, and we're doing everything we can to continue to message that. So more to come on the modeling piece, but Dr. Kwanget, any updates on that yet?
Yeah, we have made estimates of the population county by county. I'm sorry, I don't have those numbers off the top of my head or readily available. But one thing I should mention is that from the start of the outbreak, the Department of Health has treated this like a public health emergency. We knew right from the start, from the very first case, that this really needed an urgent response, and that's why we established that work group that Dr. Shaw had mentioned. And at that early moment, we had talked about, well, when do we need to go to the next step to go up to incident command? And when we reached those criteria, when the outbreak spread beyond the capacity of our normal structure, that's when we shifted to incident command with Andy Rose as our incident commander. So right from the start, we've handled this as a public health emergency, even though we haven't made the state declaration of an emergency. And Andy, I don't know if there's anything that you'd like to add to that.
Yeah, Ty would, thanks. And just to clarify from the question earlier, every state is different. So many states have different rules around what they can do leading up to an emergency and through the initial response, that they may need to declare either a governor's state of emergency or a public health declaration to be able to alleviate roadblocks. So just because we have yet to declare a public health or state of emergency in the state of Washington by no means indicates the seriousness of how we're taking this response. We just have not had the roadblocks and issues up until this point that would lead us as a state with our laws to have to declare. So we, as Dr. Shaw mentioned, continue to evaluate those. And when we reach the point where we start to forecast impedances, that's when we will work with the governor's office, our state emergency management partners, to put together a governor's proclamation of emergency for the state of Washington for Mpv. So that's kind of lead up, but I just want to make sure every state is different. Some declare early because they have more strict laws they need to set aside to be able to do work. We are lucky we don't. So that is kind of where we're at, but the level of seriousness is still heightened, still there, and every resource in the State Department of Health that is available is to bear on this response.
Thank you. This concludes the question and answer segment of our briefing. I want to thank our media partners for sticking with us as we've gone long. This was definitely an information heavy briefing, and we appreciate everything that you do to get the information out to our public on these important topics. Dr. Shah, would you like to offer any closing remarks?
Yeah, thank you, Nikki. Thank you again to you, to our team behind the scenes in TVW, as well as my colleagues, Dr. Quan Gat, Michelle Roberts, Nisha Williams, and Andy Rose for joining today. Again, they represent just the incredible amount of work that's happening at the department, at our agency, and across our state related to a number of different challenges that we are currently facing. And I think the key theme from today is prevention, 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 whether it comes to heat and the weather, the climate, whether it comes to COVID-19, or whether it comes to Mpv. We know that we can continue to work together and protect ourselves and prevent disease, again, as we continue to work collectively as a system, as a state, and as a family. So we just hope you will continue to do everything that you can to help all those around you and yourself to stay healthy. Please stay out of the sun a little bit when it's hot and heated. Just watch the hours of the day. Make sure you stay hydrated. And then certainly we want to make sure that you continue to watch for information that may be coming out from our department or other trusted partners across the state, because we want to make sure that misinformation does not ride the day, but good, solid, accurate, timely information is what we get out to the community when it comes to a whole host of conditions, including what we talked about today. So again, thank you so much for joining us today. And Nikki, I will turn it back.
Thank you, Dr. Shah. This concludes today's media availability. Like Dr. Shah, I'd like to thank all of our panelists for their time today, and our media again for sticking with us as we've gone a little bit long, and TVW for hosting today's live stream and archives of past briefings. Thank you all and take care.